Oh, thank you so much, Dr. Johnson. And as she was saying, you're getting a lot of information. You are getting information from the best, from real experts in the field. And the really good news from tonight is the fact that there is something we can do about it. We can take that information and apply it in our daily lives and be healthier and better off because of it. And our next speaker is Dr. Jill Barnes, an assistant professor of kinesiology at UW-Madison. Much of Dr. Barnes' research focused on blood flow to the brain and how that changes with exercise and aging. Dr. Barnes' lab looks at the risk factors for both heart disease and dementia, and looks at how the aging population can reduce their risks for these diseases. So please join me in welcoming Dr. Jill Barnes.
Hello, good evening. Thank you all for joining us. It's so great to see so many people in the audience and so many people who are interested in this very important topic. So I'm going to cut right to the chase and talk about the benefits of exercise. I assume most of you have already heard of this, but it becomes increasingly important as we get older. It's just as important for young people as it is for older people, but as we get older, it becomes much more important, as you'll see. Some of the benefits of exercise are that it strengthens our muscles and our bones. It reduces the risk of cardiovascular disease, as we just heard about. It can reduce the risk of diabetes. It can reduce the risk of some cancers. But what I'm going to talk about tonight are some of the changes that are due to exercise that might help us think better, think faster, and improve our cognition. So we've already heard about this theory of cognitive reserve. Dr. Morris talked about the idea of neuropathology in the brain, some of those changes in the brain that are associated with Alzheimer's disease or dementia, and how that relates to cognition. So on this figure, the neuropathology is shown at the bottom. Then the vertical line is showing the level of cognition. There's the normal cognition, and then there's this diagnostic threshold. Above that threshold means that cognitive abilities have declined, and now the person would have mild Alzheimer's disease and eventually severe Alzheimer's disease. But there's this theory of cognitive reserve that there's different groups of people. Not everybody ages the same, and not everyone experiences neuropathology and cognition the same way. This first group are individuals who have low cognitive reserve, meaning very small changes in the brain end up causing a lot of cognitive dysfunction. So what do I mean by cognitive dysfunction? Well, difficulty remembering things, feeling like you're thinking slower, maybe difficulty doing daily living tasks. These people are experiencing that very early on. But there's another group, and in this group, they have significant amounts of neuropathology. We're seeing a lot of changes in the brain that look like Alzheimer's disease, yet their cognition is fairly normal. Now, I don't know about you, but I would prefer to be in that second group, that green group, because I would want my cognitive function to be as good as possible for as long as possible. Well, what explains the differences between groups, and how can I belong to one group versus another? Well, there's two things I want to talk about today. We don't have time to cover everything, but two of these things are the idea of brain size. You already saw photos of brains from Alzheimer's patients compared to a healthy normal person. That brain size, that larger brain, might make us able to be in this group here. Our larger brains might enable us to function better. What about blood flow? We just heard about blood flow and how important it is to all areas of the body, but having more blood flow to our brain might be useful to make sure that we can improve our cognitive function and keep our cognitive abilities intact as we age year after year. How does exercise fit into this? Well, I'm going to talk about some of the research studies that show the effect of exercise on brain size as well as the effect of exercise on blood flow. So this study is showing how exercise helps maintain brain size or brain volume. What they did is they took older adults and they split them up into 4 groups based on how many blocks per week they walked. Then they followed them up 9 years later and gave them brain scans to look at the volumes of their brains. This is the results of some of the results of that study. Both of these areas of the brain are very important for Alzheimer's disease and dementia, and these 4 groups are shown here. The blocks per week that they walked are shown at the bottom. So the first group only walked 8 blocks per week, whereas the 4th group walked 156 blocks per week. And I'm sure you can see that 4th group had much higher brain volumes in 2 important areas of the brain that are critical to Alzheimer's disease. However, it doesn't necessarily mean that you have to walk 156 blocks per week. The authors determined that really the threshold for protection was around 72 blocks per week, which equates to about 6 to 9 miles. So that's more attainable or more doable for most people compared to the 156 blocks per week. So walking more blocks per week was associated with greater brain volumes. So next I'm going to move on to talk about blood vessels and blood flow, as we just heard about. Now this is a very beautiful picture, I think, of the heart and all of these arteries that are coming from the heart and delivering blood to our tissues. These blood vessels supply blood flow to many areas of the body, but primarily the heart, skeletal muscle, and brain are what I'm going to focus on. Now these areas are very important when we start to exercise, when we start moving our muscles. It requires blood flow to our muscles, we require lots of blood flow to our heart, and we require blood flow to our brain. This is a cross-section of one of those blood vessels, like you just saw in the last talk. This cross-section is showing the blood vessel as well as some of the red blood cells moving through it. Well, why are these blood vessels so important? Well, those blood vessels are very good at responding to the needs of our tissues. If my muscles are starting to work and maybe I start having to run, I have to catch the bus, my muscles are going to need more oxygen, they're going to need more nutrients, and there's going to be more blood flow delivered to my muscles to enable me to do that. The amazing thing about these blood vessels is they're very good at it. They're naturally designed to be able to do this. So how do they do this? Well, at the bottom you can see there's 2 different situations for that blood vessel to be in. The first we call vasoconstriction. So that's when the blood vessel decreases in size. So instead of being this big, it shrinks. It vasoconstricts when we don't need as much blood flow to a certain area. The other one is showing vasodilation. This is the increase in diameter of that blood vessel. That's what happens when we need more blood flow to an area. This is really just a supply and demand situation for all tissues of the body. It's the situation in the heart, it's also the situation in the brain. So how do we measure this? Well, if people come to our laboratory and we're able to get an estimate of their blood vessel health, we call this the reactivity of the blood vessels. The more reactive they are to a certain stimulus, the healthier the blood vessels. This is showing 3 doses. We can give doses of a variety of things. We can give 3 doses of a drug, we can give 3 doses of exercise, and then we can measure the blood flow response. If we measure the blood flow response, there we go. If we measure the blood flow response, we see with each increasing dose, there's more blood flow. This is an indicator of how reactive that blood vessel is. So how do we measure it? Well, we have a couple of ways to measure it. One way that we measure it in our lab is using an ultrasound machine, just like you would see in your doctor's office. This enables us to measure the blood flow every single time your heart beats. So what can we do with this information about blood vessel health? Well, one of the first studies looked at blood vessels going to the muscles. So how does the blood vessels that are supplying the muscles, how do they react to certain doses of a drug? You can see the doses at the bottom. The top is showing muscle blood flow, the actual blood flow being delivered to the tissue. The bottom is showing the blood vessel vasodilation, how much that blood vessel is increasing in size. The blue lines are showing young, healthy people. The green lines are showing older, healthy people. You can see just aging by itself reduces the reactivity of that blood vessel. Now, these individuals were sedentary. They didn't exercise, but they were otherwise healthy. Next, these same investigators did the exact same thing, but they recruited different groups of people. This time, they had adults who were exercise trained, meaning they had regularly exercised for many years. Now, the young and the older adults had the exact same response in both blood vessel size as well as muscle blood flow. So this is good news. Exercise by itself for the arteries seemed to completely abolish or get rid of the effect of aging. Now this was to the muscle. Blood flow regulation to the muscle, blood flow regulation to the heart is a little different than blood flow regulation in the brain. So my laboratory was interested in this. We looked at the reactivity of the brain blood vessels to see if we could see a similar thing. We started by just looking at younger healthy adults and older healthy adults. Instead of giving a dose of a drug, we had them breathe different gases. Breathing gases like carbon dioxide, this was a large amount of carbon dioxide, causes increased blood flow in the brain. In the younger adults, they had higher blood flow response compared to the older adults, so very similar to what we saw in the previous study. When we look at the slope of this line, this is just expressing the data in a little bit different way. And you can see that there's an age-associated reduction in the reactivity of those brain blood vessels. So normal aging seems to reduce the reactivity of the brain blood vessels, very similar to what we saw in the muscles. I'm sure your next question is going to be what happens with exercise. Well, one of the things that is important about exercise is that doing exercise is one thing. How fit you are is something else. So we were interested in the blood vessel reactivity in the brain and how this relates to someone's fitness. How do we measure fitness? Well, in the laboratory, we can measure fitness by putting someone on a bicycle and having them exercise at a very low intensity, and we just gradually increase that intensity. We increase that dose of exercise until they're done. We don't make them go for very long, it's usually less than 12 minutes, but we really stress them. We really increase this intensity, very similar to a stress test that some of you may have had. So we do this on a bicycle, then we measure their heart rhythms, we measure their blood pressure, we ask them how they're feeling, we try to get a sense of how fatigued they are, and then we also are collecting all of the air that they're breathing, and from that we can quantify how fit they are. They get this value that's called VO2 max, and the higher that number, the fitter they are. So we wondered how fitness relates to blood flow reactivity in those blood vessels that are in the brain. When we looked at younger adults, there didn't seem to be much association between fitness and reactivity. Each of these dots is one individual subject from this study. The bottom is showing that VO2 max value, and the vertical line is showing their reactivity. So in young adults, we didn't really find anything. And we were a little bit surprised about this, but young healthy adults, their blood vessels are usually working pretty well, so maybe it wasn't so surprising. When we looked at older adults, then we saw a significant association, such that older individuals that had higher fitness also had greater reactivity of their brain blood vessels. So maybe it's not just how much exercise you do, but kind of a combination of how much exercise you do and if you're doing it intensely enough and regular enough to maintain high fitness levels. So if we combine what some of these studies have shown, aging itself is associated with dysfunction in the blood vessels. Now we just heard about plaque. If there's more plaque in the artery, that's going to make blood vessel dysfunction even worse. But in people who have normal cholesterol and are very healthy, if they aren't active, we see blood vessel dysfunction in them as they get into their 50s, 60s, and 70s. And also, some of those changes in the blood vessels might be related to future risk of cognitive decline, because at this point they're still healthy. This blood vessel dysfunction might lead to decreases in blood flow, specifically blood flow to the brain. It may also lead to decreases in brain volume or brain size. This brain volume and brain size is very important in cognitive function, and blood flow to the brain is very important in cognitive dysfunction. So one idea is that aging, because of this blood vessel dysfunction, might be causing issues with cognition later in life. Eventually, people will cross that threshold and develop Alzheimer's disease or other dementias. The good news is exercise seems to be protective, meaning it's not causing blood vessel dysfunction. It's helping protect the brain, helping protect those blood vessels from the effects of aging. Exercise has also been shown to be effective in reducing or in inhibiting changes in blood flow and inhibiting changes in brain size so that we can maintain proper blood flow and maintain our brain volumes for longer. And exercise, therefore, can be very good at improving cognition. There's lots of studies that show how exercise is so important for cognitive function to increase scores on some of these cognitive tests. And even if you ask people, they'll report that they feel like they have better memories, they feel like they can remember things, maybe their mind's a little bit clearer, especially after exercise. So there's still some questions that remain. It seems like exercise is good. We believe that exercise is good, but what else do we not yet know? Well, one area that my lab is interested in looking at is how does exercise improve the brain? We have a couple of ideas and a couple of studies that we looked at for different things that change when we exercise and how that may relate to blood vessel health. Another question is what mode of exercise is beneficial? We know aerobic exercise is good, but not all exercises have been tested to really see what is the best exercise one can do to improve blood flow to their brain. And lastly, how can these benefits of exercise be optimized? We heard about the mind diet. Perhaps an interaction between improving or increasing the amount of exercise we're doing, improving our diet, might really help optimize this and make for a healthier brain. So now maybe I've convinced you that if you are exercising, to keep on going, and if you're not yet exercising, maybe you can think about talking with your healthcare provider about exercise. But what are some of the things that you yourself can do? Well, one of the things I like to recommend is increasing daily movement. It doesn't have to be exercise per se, just moving around. So one of the things is when you get up in the morning, first thing, taking the dog for a walk, doing a few stretches, maybe doing some light arm exercises or yoga poses, something like that really could be helpful at getting your day going and getting moving. Because the brain and the muscles are very similar in the aspect that you have to use them to make sure that you maintain their volume. A second thing is thinking about active transportation. In Madison, we're very lucky. We have lots of bike paths. We have good public transportation. There's lots of sidewalks in which you can walk, you can ride a bike, you can walk to public transportation. Maybe not every time, but maybe just on occasion, because you're getting more steps in per day. You're just moving, and it's not even exercise. You don't even have to work up a sweat. And lastly, you can think about moving during transition time. One of the things, if you're waiting in line at the grocery store, or maybe you're waiting in the doctor's office, or it's a commercial break during the football game, you can get up and move a little bit. You can just contract a few of your muscles, just loosen up, move around. All those little things don't seem like a big deal, but over days, weeks, years, they really add up. So that's one way to increase just daily movement. Next, we need to talk about scheduling exercise sessions. So in your packet, you should have a form that looks similar to this. Also, there was a few books that were out there at the expo that talked a lot more about scheduling these exercise sessions. You can schedule them like an appointment. You can use this type of form, which is available at the NIH website, to log the types of exercise you're going to do, or record what you're planning to do, maybe with somebody else, maybe by yourself. You don't have to have a gym. You can do these types of exercises many different places. So some of the exercises that are usually considered aerobic and highly recommended 5 times per week for 30 minutes, but that 30 minutes doesn't have to happen all at once, are walking or hiking, dancing, biking, swimming, playing sports. Really, the list is endless at how many different exercises you could do. Now, any type of exercise is beneficial. We're trying to figure out maybe the best type of exercises, but right now, we believe any exercise is beneficial. But you should try to include moderate to vigorous intensity exercise. So if someone wants to improve their level of fitness, it's recommended that they do moderate to vigorous intensity exercise. So what does that mean? Well, that means if you're walking with someone or you're doing an activity with someone, you shouldn't be able to have an entire conversation. That means you're not working hard enough. It doesn't mean you can't ever have a conversation, but at least once per week, you should be able to be exercising hard enough that you can't have a conversation. It's good to be able to say a few words, but to not tell a story about how your day was the day before to your friend or your partner. And lastly, it's important to include strength, balance, and flexibility exercises. So again, that NIH website has a couple of suggestions. One of the books that they had out there had a couple of suggestions, and you don't need fancy gym equipment. You can do a lot of these exercises at home, and most of you already probably know many of the exercises, but a good reminder is on that website of certain strength, balance, and flexibility exercises you can do. So with that, I'm going to leave it there, and we'll be happy to take questions from the audience during the panel as we all come up here. So thank you so much for your attention tonight.